Okay, so before going into the patient's room, I would get my Foley tray kit and I would verify my order to insert for a catheter, and I'll get any assistance that I need beforehand if I needed extra assistance. So I would walk in, introduce myself. Hi, my name's Jara. I'm a student nurse at Southeastern. I'm here to insert your Foley catheter. I would ID the patient using 2 identifiers. Can I get your name and date of birth? And then I would ask the patient if they had any allergies to betadine. And if they did, I would use Hibiclens. So I would set this down. I would assist the patient in the dorsal recumbent position with the knees flexed and the feet 2 feet apart. And then I would put on disposable gloves and clean the perineal area. I can just use a warm washcloth with soap and water, and I would clean front to back and use a different corner for each side, for each stroke. And then after that, I would discard my gloves and open my sterile kit and perform hand hygiene. So I'm gonna open my kit. I'm trying to work with room here. Yep. I'm just going to turn this kind of to the side so I have more room. Okay, I'm going to grab my first drape and I'm going to put this side down since I touched it. And I'm just going to slide it under the patient's butt. Okay, I'm going to connect these, use this as my field, and I'm going to grab this drape to place over the perineal area. Okay, now I'm going to grab my sterile gloves. Oh, that's all backwards, but we're gonna work with it. Okay, so in the real life situation, I would just get a new pair of sterile gloves, but we can make this work if I was to break sterile field or not be able to use these because it's on backwards. Anyway, okay, now I'm gonna just kind of move this over and I'm gonna set my betadine out right here. And I'm gonna open my lubricant and put it into this little compartment right here and discard that. Just gonna kind of set this off to the side. And I'm gonna find my catheter tip. Of this and allow it to sit in lubricant. I'm then going to take my 10 cc syringe and connect it to the catheter. Now I'm going to lift the labia minora, and keep in mind that this hand is no longer sterile. And I'm going to identify the urethra meatus. I'm going to, there's 3 sticks, and I would use each betadine stick for each stroke. So I would use one for the right side, discard, grab another for the middle, discard that one, grab another one for the left side. So once we clean it with the betadine area, we're going to grab our catheter and insert for 2 to 3 inches, or until we get urine output. Once we get urine output, we're going to insert 2 to 3 more inches, and we're going to secure it and inflate our balloon. Okay, so once our balloon is inflated, I'm going to disconnect this. And I'm going to just gently tug on it to make sure it's secure and in place. I would then secure the catheter to the patient's leg, leaving a little bit of slack for it, and I would make sure that the clamp on the Foley bag is closed. Once we've done that, we can hang it below, ensuring that it's below the bladder, and hang it to the side of the bed with the clip that is provided not to the side rail. So we would do that, and then we would discard of all of our supplies, clean the perineal area as needed, and get rid of all this. So for removal, the only thing we would need is a 10 cc syringe, so we're just going to use this one. And we would go in, the whole process. First thing we would do is empty our Foley bag and measure the output, and then we can just set it on the bed. We would untape the catheter from the patient's leg and use our syringe, connect our syringe to remove the inflated balloon. And you would want to double check on the orders that it was a 10 milliliter balloon that it was filled up with. So once it's all out and you have 10 milliliters, you are going to ask the patient to take a deep breath and gently remove the catheter. You would then discard of everything and clean the perineal area as needed. Make sure the patient doesn't need anything. Call bell's in reach, bed is lowered, rails are up, and you're done.